Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a presentation by a pediatric nurse named Jennifer Collins, who's discussing her work with childhood asthma patients. You now have 90 seconds to read questions.
My name's Jennifer Collins, and I'm a pediatric nurse specializing in the care of children with respiratory conditions, particularly asthma. Today, I'd like to share with you some insights into the kind of work I do, focusing on a recent case involving a young patient, let's call him Liam, to illustrate the challenges and responsibilities involved in managing childhood asthma. Before I tell you more about Liam, let me give you a bit of background on asthma in children. Asthma is one of the most common chronic conditions in children, affecting millions worldwide. In the UK alone, over 1.1 million children receive treatment for asthma. It's a condition that causes the airways to become inflamed and narrow, leading to breathing difficulties. Symptoms often include wheezing, shortness of breath, and a tight chest, and these can vary in severity from mild to life-threatening. Early diagnosis and proper management are crucial in preventing severe attacks and ensuring that children can lead healthy, active lives. Now, regarding Liam's story, like many young children, Liam was diagnosed with asthma when he was just 4 years old. His parents noticed that he frequently had trouble breathing, especially after playing outside. Initially, they thought it might be due to a cold or allergies, but when the symptoms persisted, they took him to their GP. After a series of tests, including a lung function test, Liam was diagnosed with asthma. This came as a shock to his parents, who had no history of asthma in the family and were unsure how to manage the condition. Liam's case required careful monitoring and a tailored treatment plan. I first met Liam and his family during one of their visits to the pediatric respiratory clinic. At that time, his asthma was poorly controlled, and he had experienced several flare-ups that led to emergency visits. My role was to help the family understand the importance of consistent medication use, recognize triggers, and manage symptoms early to prevent severe attacks. We discussed the use of inhalers, both preventer and reliever, and the need for a clear action plan in case of an asthma attack. One of the main challenges we faced was Liam's reluctance to use his inhaler. Like many young children, he found it uncomfortable and was often scared. To address this, I worked closely with his parents to find ways to make the process less intimidating. We introduced a spacer device, which made it easier for Liam to use the inhaler correctly, and I spent time showing him how to use it in a fun, non-threatening way. We also worked on identifying and avoiding triggers, which for Liam included cold weather and exposure to pet dander. Another important aspect of managing Liam's asthma was educating his parents and school staff about the condition. Children spend a significant amount of time at school, so it's vital that teachers and school nurses are aware of each child's needs. We developed an individualized asthma action plan for Liam that was shared with his school. This plan outlined what to do in case of an asthma attack, the signs to watch for, and when to administer medication. Unfortunately, despite our best efforts, Liam experienced a severe asthma attack at school one day. The school staff followed the action plan perfectly, administering his reliever inhaler and calling for emergency help. When I visited Liam in the hospital afterward, he was understandably shaken, but we used the experience as an opportunity to reinforce the importance of his treatment plan and to reassure him that he was not alone in managing his condition. Liam's story is a reminder of how unpredictable asthma can be, and why ongoing education and support are crucial. Managing asthma isn't just about responding to emergencies, it's about preventing them from happening in the first place. This involves regular checkups, monitoring lung function, and making adjustments to treatment as needed. For example, in Liam's case, we increased his preventer medication during the winter months when his symptoms were worse, and ensured that his parents knew how to monitor his peak flow readings at home. For me, one of the most rewarding aspects of my job is seeing the positive impact that good asthma management can have on a child's life. Over time, Liam's condition improved significantly. He became more confident in using his inhaler, and his parents became more adept at recognizing early warning signs and managing his triggers. Liam was able to return to playing football with his friends, something he had been afraid to do before because of his asthma. In conclusion, while asthma is a chronic condition that requires ongoing management, with the right support and education, children like Liam can lead full, active lives. As a pediatric nurse, my role is not just to treat the condition but to empower both the child and their family to take control of it, ensuring that asthma doesn't hold them back from doing the things they love.
Extract 2. Questions 37 to 42. You hear a presentation by Dr. Emily Hartman, specialized in cardiology. Now, read the questions. You now have 90 seconds to read questions.
My name is Dr. Emily Hartman,
and I specialize in cardiology with a focus on the management of hypertension, often referred to as the silent killer. It's a condition that affects millions worldwide, yet it often goes unnoticed until it leads to serious complications like heart attack or stroke. What's particularly concerning is that hypertension doesn't discriminate. It affects people of all ages, ethnicities, and backgrounds, making it a universal health threat. One reason for this widespread impact is that the symptoms of hypertension are often subtle or even non-existent. This lack of obvious symptoms can lead to delayed diagnosis and treatment, which significantly increases the risk of severe cardiovascular events. In my experience, a major issue with hypertension is the casual attitude some patients and even healthcare providers take towards it. I've seen cases where patients, after being diagnosed, do not adhere to their treatment plans. They may start taking medication but then stop once they feel better, not realizing that hypertension is a chronic condition that requires ongoing management. This intermittent adherence is particularly dangerous because it can lead to sudden spikes in blood pressure, which are more damaging than consistently high blood pressure. Healthcare providers also play a role in this. Some fail to emphasize the importance of lifelong management, instead focusing on short-term results, which can mislead patients into thinking they are cured. Another contributing factor to the high prevalence of hypertension is the lifestyle choices that many people make. The modern diet, rich in processed foods and high in salt, combined with a sedentary lifestyle, is a perfect recipe for developing high blood pressure. Many patients are unaware of the impact that diet and exercise have on their blood pressure. For example, reducing salt intake and increasing physical activity can significantly lower blood pressure, sometimes even eliminating the need for medication. However, this requires a significant lifestyle change, which can be difficult for many people to maintain. The role of stress in hypertension is also often underestimated. Chronic stress can contribute to the development and exacerbation of high blood pressure, yet many patients and healthcare providers do not address this adequately. In recent years, there has been an increasing recognition of the importance of early intervention in managing hypertension. The earlier we can detect and treat high blood pressure, the better the outcomes for the patient. This means that regular screening and monitoring of blood pressure are essential, especially for those with risk factors such as obesity, diabetes, and a family history of hypertension. I've also seen a growing trend towards the use of home blood pressure monitors, which allows patients to track their blood pressure more frequently. This can be particularly useful for those with a white coat syndrome, where their blood pressure spikes in a clinical setting. However, it's important that patients are properly educated on how to use these devices accurately and consistently. I'd like to discuss a case that illustrates the challenges of managing hypertension effectively. Let's take a hypothetical patient, a 45-year-old man named John, who was diagnosed with hypertension 5 years ago. John was initially prescribed a combination of medication and lifestyle changes, including dietary adjustments and regular exercise. For the first year, he adhered to his treatment plan and saw a significant reduction in his blood pressure. However, as time went on, John began to feel complacent. His blood pressure readings were within a normal range, so he started to skip doses of his medication and gradually returned to his old eating habits. Unfortunately, this led to a gradual increase in his blood pressure, but because he felt fine, John didn't see the need to return to his doctor. It wasn't until John experienced chest pain and shortness of breath that he realized something was wrong. He was rushed to the hospital, where it was confirmed that he had suffered a mild heart attack. The heart attack was a direct result of his uncontrolled hypertension, which had gone unnoticed due to his irregular adherence to his treatment plan. Fortunately, John survived the heart attack, but it served as a wake-up call. He is now under strict medical supervision, with a renewed commitment to his treatment plan. This case highlights the dangers of not taking hypertension seriously and the importance of ongoing management to prevent serious complications. In conclusion, managing hypertension effectively requires a combination of patient education, lifestyle modifications,
and consistent medical treatment. It's crucial for both patients and healthcare providers to understand that hypertension is a chronic condition that needs to be managed for life. Early detection and intervention are key to preventing the severe consequences associated with high blood pressure. By working together, we can help patients like John avoid the pitfalls of non-adherence and lead healthier, longer lives.
That is the end of Part C. You now have 2 minutes to check your answers.